Welcome back this morning. Well, there's so many studies exploring Black women's experiences in healthcare, with so many sharing stories of being ignored or being unheard in their doctor's office. There's actually a survey conducted by Kaiser Family Foundation. It found about 21% of Black women said they have been treated unfairly by a healthcare provider or the staff there. 22% of Black women who were pregnant or gave birth say they needed pain medication, but medical staff refused. And if it's these type of experiences that inspired a former Northwestern resident to write a book about discrimination against Black women in healthcare and dig into this. Dr. Kemi Doll is the author of A Terrible Strength: The Hidden Crisis of the Black Womb and Your Survival Guide to Healing. And Dr. Doll is joining us live in studio to talk more about this, and we're so grateful that you're here just to share these experiences and bring them to our audience so maybe people will learn more about this. Welcome.
Thank you so much for having me. I'm happy to be back in Chicago.
We're happy to have you here in studio as well. So in your book, you write specifically, Black women's wombs are in crisis, especially when we are not pregnant. What concerns are you looking to raise, and can you just elaborate on that?
Absolutely. You know, we spend most of our time not pregnant. And the case right now is that Black women suffer disproportionately from fibroids, endometriosis, very heavy and irregular cycles, and even uterine cancer, which is on the rise. I call it a hidden crisis because it's so common and yet very rarely discussed.
And why do you think that it's rarely discussed?
I think that we all have a silencing around the things that go on down there.
Yeah.
And unfortunately, a lot of what we learn when we first have our period or get started into all this is how to keep it quiet. But that means that we also keep symptoms quiet. We keep suffering quiet, and that's what has to change.
Part of your research, if you will, and your experience in this, many of your patient stories and medical experiences described in the book are from your time in Chicago.
Yes.
Can you tell us about that and what you witnessed?
Absolutely. I got incredible clinical training in Chicago. I'm so grateful. But I also learned the ways in which some women weren't treated the same. Black women's pain was often dismissed or minimized. I saw Black women walking around with life-threatening levels of anemia, just working, moving through the world, taking care of their children, because we didn't see them as vulnerable enough. These are the experiences that really made me want to pursue research and understand what's going on with Black women's womb health and how can we change it.
Yeah, I was curious about how what you saw and what you witnessed really changed the course of your work and what you're doing now.
Yeah, you know, one of the things that I saw that was very disturbing was that uterine cancer, which is a cancer of the womb, which is rising right now in incidence, I saw that we were taught that it was generally a good cancer to get and that most people survive and most people are diagnosed very early. But that's not the case for Black women. So both at Prentice Hospital and at Stroger Hospital, I saw women consistently coming in with advanced stage disease that's much harder to cure. Those were the experiences I had that made me think we don't have the whole story here, and we need to dig in to understand how we can change this.
And is part of this solution space giving recommendations? Because I know people watching are probably thinking, wait, maybe they had an experience like this. Maybe they felt ignored. Maybe they didn't feel listened to. So what do you want people watching right now and readers of your book to take away from this? What can they do?
Oh my gosh, there's so much that we can do. First, individually, we have got to stop normalizing the abnormal. If you're bleeding too much, if your cramping is too painful, that does not have to be your norm. So I really encourage women to keep a symptom journal, even for just a few months, to understand what is my normal. So if it changes, you can compare. And if it's abnormal, when you go to the gynecologist, you're already starting with data that we can work with. It's a game changer in terms of those visits. It also makes it much less likely that you can be dismissed.
Yeah, sometimes, you know, now in the healthcare system, you might get a 15-minute visit.
Yes.
And sometimes it's hard to advocate for yourself when you feel like things are rushed. So you're saying go in with some information.
Yes.
And therefore you have a starting point.
Exactly, and the right language. So I talk about this in the book. The way that we doctors learn how to think about symptoms is a little bit different than how we as a patient would express it. Instead of saying, you know, I'm bleeding really heavily, but I'm making it through, you have to be clear about what adaptations are you making just to make it through the day. Are you using way too many pads and diapers and things to get through the day? I tell people to say things like, listen, this is a change from my baseline. This is not my normal. Those are the kinds of phrases that shift us into action.
That's so helpful. Dr. Kemi Doll, thank you so much for joining us. And I want people to know that if you're watching and you want to learn more about this and you want to get more information, Dr. Doll is hosting a book talk that's tonight. It's at 7 at Call and Response Books in Hyde Park. And that's a place that you can go and learn more and go more in depth with this.